Welcome back. In the chapter of health programs in India, in today's session, we will be dealing with national programs for prevention and control of Japanese encephalitis. As we studied earlier, the National Vector-Borne Disease Control Program is an umbrella program. It is implemented for the prevention and control of six vector-borne diseases. What are those six vector-borne diseases? The National Vector Borne Disease Control Program is directed for the prevention and control of these six vector borne diseases, namely malaria, filariasis, dengue, Japanese encephalitis, Kala Azar, and chikungunya. In our previous videos, we have dealt with malaria, lymphatic filariasis, Kala Azar. In today's video, we will be discussing about Japanese encephalitis, followed by dengue and chikungunya. To begin with, the Japanese encephalitis, the first case was reported in 1955. You see, the first case was reported in the year 1955. During the recent past years, that is 1998 to 2004, 15 states and union territories have reported the Japanese encephalitis incidents. So, new cases have been reported in the past few years from 1998 to 2004 in 15 states, namely Andhra Pradesh, West Bengal, and we have Assam, Tamil Nadu, Karnataka, Bihar, Maharashtra, Haryana, Kerala, Manipur, Uttar Pradesh. They are reporting the maximum number of cases in the recent past few years. Thus, the Japanese encephalitis has become a major public health problem. Now we move on to the most important part under each program is the strategies. From your exam point of view, you have to mention the strategies under each program. We see in Japanese encephalitis, the strategies which were for the prevention and control includes the strengthening of surveillance activities. So they strengthen the surveillance activities. How did they strengthen it? By setting up the sentinel sites in the tertiary healthcare institutions. So, guys, the surveillance was done. They made a, the reports were all collected and they made a data sheet out of all the reports to find out how is the Japanese encephalitis being spread and what are the causative factors, the risk factors, and what is the percentage of the people affected, which states are affected. All of this was carried out with the surveillance activities with the help of the sentinel sites. Next, we have early diagnosis and proper case management. So the case management was done by the laboratory diagnosis or the clinical management was done, and very early diagnosis, quick diagnosis was done. Okay, behavior change communication. What does behavior change communication mean? We are providing this information, education by communicating with the society, with the community, where there is an interpersonal interaction. We are communicating with the community and we are bringing in awareness, we are educating them, providing information. What information we will be providing them and how we are bringing in the awareness will be said in the upcoming slide. Moving on, integrated vector control. So this vector needs to be controlled. We have this chemical control like fogging the malathion, or we are giving this personal protection. We are asking them to wear full long sleeved clothes and keeping the pigs away in the pigsties. So all of these will be the vector control. And capacity building in the last thing. The capacity building is nothing but we are training and strengthening this human resources and we are improving the skills and the knowledge of the human resource. Okay, so this was about the strategies. I hope they have got some clarity in your understanding. So what are these? We have strengthening of surveillance. We are strengthening the surveillance activities. How are we strengthening the surveillance activities? By setting up the sentinel sites in the tertiary healthcare institutions like PHCs, Anganwadis. So tertiary healthcare institutions, we are setting up some sentinel sites, and we are strengthening the surveillance activities. Early diagnosis and proper case management, we saw that. Behavior change communication, integrated vector control, and capacity building. As there is no specific cure for the disease, early case management is very important. So, we know that early case management is very, very important in case of Japanese encephalitis, as there is no cure for the disease. In order to minimize the risk of the complications and death, we need to perform the early diagnosis and give a complete and prompt treatment so that we can prevent any complications and death. The Japanese encephalitis vaccination is recommended for children between 1 to 15 years of age. So we see that we are giving the vaccination for the children aged 1 to 15 years. In addition to this, health education is given through different media. So we saw the behavior change communication, wherein we are giving the health information or the health education using the different medias, and interpersonal communication for the community is very crucial. So all of these points we have studied. So this is just an elaboration to the key points. Case management, it is very important to minimize the risk of complications and death. And then we are giving this vaccination for the children aged 1 to 15 years of age. Addition to this, in the behavior change communication, you can see that we are providing the health education using the different medias, and also doing this interpersonal communication. Different medias, it could be radio, using the television, advertisements. So using the different medias as printing articles. So different medias we are using and giving the health education. In addition to this, the interpersonal communication to the society is also crucial. And also, the emphasis should be given on keeping the pigs away from human dwellings. We need to keep the pigs away from our homes, or we have to keep them in the pigsties. So you can see here, keep the pigs away from the house, because they are the ones who are the source of causing this infection. And the Sculex mosquito acts as a vector. It will transmit the infection from the pigs or the swans to human beings and animals like horses. So this was that about the Japanese encephalitis. When we study the disease, we will study the causes, pathophysiology, clinical features, the other part. Okay, for now we are studying about the program. So in this program, in order to prevent it, what can we do? Keep the pigs away from the house or the human dwellings in the pigsties. Then use the clothes which cover the full body to avoid the mosquito bites. It is quite advocated that we need to use the clothes which are covering the body fully. And use of bed nets is also a very important precaution. You can see when we use the bed nets, the Culex mosquito cannot bite us, and we will not be infected with Japanese encephalitis. Moving on, the community should be given full information. Again, what information are we giving to the community? We know that we are giving information to the community. What information is given to the community? We are giving the information about the signs and symptoms of the disease and the health facilities which are available at the health centers, the health facilities which are available in the hospitals. All of this awareness. What are the signs and symptoms? If I am contracted, or if I am infected with Japanese encephalitis, what are the signs? What are the symptoms which are found in a person? Once this awareness is spread, then the person will reach the hospital at an earlier phase, and then the treatment can be started in a very early stage, and we can prevent the complications and death. The states are also advised to use the malathion for outdoor fogging as an outbreak control measure in the affected areas. If there is an outbreak of Japanese encephalitis, if there is some epidemic or there is an outbreak of the Japanese encephalitis, then we have malathion fogging. You can see here, malathion fogging is done as a control measure in these high risk affected areas. So, this was all about the Japanese encephalitis program. The key points you have to remember are these strategies where we strengthen the surveillance activities through the sentinel sites, capacity building, early diagnosis, proper case management, behavior change communication, and integrated vector control. And the elaboration to that, you have to write down that there is no cure, so we need to do the early diagnosis and give the prompt treatment so that we prevent the complications and death. We have this vaccination given to the children 1 to 15 years, and we give education using this medias and interpersonal communication. And what education you're giving to the people, you're educating the people about the signs and symptoms, what are the health facilities which are available to them, and then other things, we have to keep the pigs away from the human dwellings. We should wear the clothes which are covering the full body. We should use nets to prevent the bite of the mosquito as a precaution. In case an epidemic outbreak occurs, then we have to use this malathion fogging as a control measure. So this was all about the Japanese encephalitis program. I hope it is clear, and in the next video we will discuss about dengue fever and chikungunya, and thereby we'll be completing the NBBDCP. I hope you like the video. If you like it, hit the like button and subscribe.